Now, the much-awaited Phase 3 trial of the world's most clinically advanced malaria vaccine beginning today in Gabon. Now, this trial marks the start of the largest malaria vaccine in history. To tell us more about this, we're joined from our studios in Libreville, Gabon, by Dr. Maxine Agnanji, the medical researcher at Lambereen's Schweitzer Hospital. Thanks so very much for joining us, Doctor. Let's start off with the significance of this, because this is going to be the largest vaccine, or the most important and significant malaria vaccine trial that we've had to date. Tell us about the process that we've gone through to get to this point.
Yes, thanks for your question. Very interesting, because now we are dealing with that vaccine trial, which is still ongoing, but we have already promising results. We are conducting a phase 3 trial among 7 countries in Africa. Among them, there is a research center in Gabon doing that study. We have more than 15,000 children vaccinated that we are following, and we expect by 2015 that WHO may decide whether this vaccine will be used for children in Africa or not. But right now, we have published already 2 interesting and promising results.
So tell us about those. I mean, you're talking about promising results that have come through. What is the minimum requirement from the World Health Organization when it comes to approving and allowing a new vaccine to be put to the market?
Yes, malaria vaccine is one of the most challenging enterprise for scientists, for health scientists. And now we are getting there. The vaccine we have now, RTS, which is still in trial, has showed about 1/3 reduction of malaria cases, 1/3 to half cases in a given population of children, which is very important from public health perspective. That means in a very simple word that we can reduce number of cases each year by 1/3 to half of cases, which is very important achievement, landmark achievement. But for us as a scientist, this is not the final goal. We aim by 2025 reach a 2nd generation vaccine. WHO will decide in 2015 whether RTSS vaccine, which shows about 1/3 to half reduction, is relevant to be given to children via public health programs. I think it's something already possible. I'm really confident that it can be the first generation malaria vaccine for children in Africa.
It certainly is important because given the fact that it's one of the 3 major lethal diseases affecting children in Africa, and we know, I think just looking at the 2011 numbers, and I'm sure that of course we have new numbers from that, but 700,000 people died from malaria in that year, and that's most of them in sub-Saharan Africa. So this is still a very important disease that still affects many people. Without a vaccine, is the fight against malaria progressing?
Yes, we have done a lot of progress with about malaria control over the last decade. A lot has been done, but definitively a vaccine will be one of the key tools to go through the control, to go through to achieve elimination, even eradication of malaria. It's a key tool. So we need that vaccine. So now I think with RTSS we are going to reach maybe the first generation of vaccine, but we should continue to work on the development, on an improvement of malaria vaccine to reach a better vaccine by 2025, which is very important for us. So we need to continue to work on malaria vaccine.
But Doctor, I mean, one of the biggest issues for you is you've got funding up until 2014, but beyond that, to reach your 2025 goal, you haven't secured funding as yet. I mean, tell us about the size and the amount of money that you need to really be able to have the second generation vaccine come to the market.
Yeah, thank you for that question. This is very important for us as a scientist. Funding is very important, and yes, definitively the funding of research, of clinical research in Africa to tackle most of the most important infectious diseases is very important. Right now we have funding from US mainly, from European Union mainly, but I think definitively we need also private donors from Africa continent, for the future generation of research, for facilities, for new innovative research ideas and development. This is very important that we should have funding from private donors from Africa continent. That is very important and challenging. Yeah. So, as you said, we haven't secured yet the funding for the future, for the new generation of malaria vaccine. So this is an opportunity for me to call for funding from private donors in Africa.